and welcome. You're watching Health Talk Session by Yashoda Hospital. Heart disease is a major health concern in today's era. Besides taking medicine or undergoing a surgery, a person can take a range of actions to improve their heart health. So let's discuss about what is the role of diet and exercise for a healthy heart in our today's episode. I'm Dr. Lakshmi, and joining us today we have with us Dr. Rajshekhar V, consultant cardiologist from Yashoda Hospitals, High-Tech City. Welcome, doctor.
Hello.
So doctor, I'm sure most of us are aware that a certain kind of diet, food can increase the chance of a heart disease in a person. So what exactly is the significance of diet for a heart disease?
Well, the importance of a good diet for preventing heart disease has been really recognized more and more during recent times. For many decades, actually most people, including physicians and nutrition experts, were actually on the wrong track with respect to diet and heart disease. For many years, it was felt that a diet which is high in fat is bad for heart. And therefore, a lot of experts, they advised us that they should reduce the fat in their diet and increase the carbohydrate in the diet. But now we have robust evidence in the form of many good population studies that when the carbohydrate in the diet crosses 40 or 50% of your source of calories, then it steeply increases your risk of heart disease. So a diet which is high in carbohydrate is not good for the heart. And similarly, and very interestingly, we have found that a diet which is high in fat, regardless of the nature of fats, is actually not harmful for heart disease. So an ideal diet in terms of a healthy heart is a diet which is rich in complex carbohydrates, that is carbohydrates which are not refined sugars, carbohydrates which are complex in the form of whole grains and whole cereals, and which are high source of fiber, along with a moderate amount of good fats, and a diet which has got an adequate amount of protein for building up of the muscle mass is good for heart health.
Thanks for busting that myth, because most of us think that fats are harmful for the body, especially someone with heart disease.
Yes, it's an important fact. A good amount of, a moderate amount of fats, which are especially, when we say fat is bad for health, we are referring to this kind of refined fats or fats that are high in trans fats. So these are the industry processed oils, and industry processed fats are not good for health. But naturally occurring fats such as butter, cheese and ghee are actually good for the heart.
We all know that exercise is beneficial for a healthy body, a healthy mind, and also a healthy heart. I'm sure I don't have to convince you when it comes to talking about benefits of exercise for a healthy heart.
Yes, exercise is just as important as diet in not only maintaining ideal body health, ideal body weight, and also for the health of your heart. So most of experts, most of the guidelines say that at least 30 minutes of exercise, good quality aerobic exercise for at least 5 times a week is the minimum that is required for good heart health. So that comes to an average of 150 minutes of good aerobic exercise, moderate intensity exercise, that is minimum that is required for a healthy heart and a healthy body. However, there are several aspects to exercise. One is aerobic exercise, which is good from the point of view of heart fitness and overall general health. Second is muscle health. For muscle health, we need a little bit of weight training, which is required by using low intensity, low amplitude weights with frequent repetitions, which is very good for maintaining the health of the muscles. And the third aspect of physical exercise is flexibility. For flexibility, we recommend exercises such as yoga or stretching, which is very important to prevent injuries when you do the other forms of exercise. So if you have a flexible body, you are less likely to be injured when you do a jog on a treadmill, or when you do a run, or when you do any other form of aerobic activity. You are less likely to be injured if you are flexible.
But doctor, is there such a thing as too much exercise? Because these days we see especially young persons collapsing at the gym while working out. Why do you think this is happening?
So we know that minimum amount of exercise is about 150 minutes of moderate intensity exercise that is good for the heart. So what happens if you exercise more than that? So as you keep on increasing the amount or the duration with which you exercise, the benefits keep on increasing, and you can go up to a maximum of 600 or 720 minutes of exercise per week. When we speak of exercise, what is good for health and what is good for the body overall is a moderate intensity exercise, which is in the aerobic range. So there is a certain range of exercise during which allows optimal functioning of the body systems, including the heart. So it is recommended that 80% of exercise should be of this intensity, of moderate intensity.